Welcome to Saving Lives in New Jersey, the COVID-19 Vaccine and You, a video podcast presented by the New Jersey Department of Health. I'm Meg Fisher. I'm a Pediatric Infectious Disease Specialist and a special advisor to the Commissioner of Health. Joined with me today are Jennifer Furron and Dr. David Adinaro. Jennifer, can you tell us a little about yourself?
Hello, I'm Jennifer Furron. I'm the policy advisor for the department. I've been with the Department of Health for about 2 and a bit years now. I'm a public health professional in my background, and at the department I work on analysis, generation, and implementation of public health policies. In the vaccination response, I've worked closely with our professional advisory committee, as well as all of our different work groups to develop vaccine policy for state leadership.
Thanks, Jennifer. And Dr. Adinaro, tell us a bit about you.
Hi, David Adinaro. I'm a lifelong New Jersey resident. As a physician, I'm board certified in emergency medicine. I joined the Department of Health just at the beginning of the pandemic and helped run one of the field hospitals that was taking care of COVID convalescent patients. And then I became, in June, the Deputy Commissioner for Public Health Services and helped run a lot of the response continuum for COVID, including major portions of our vaccine program.
Who actually gives you the vaccine? Are they trained? Do they know what they're doing?
So right now, the vast majority of people who are able to vaccinate are the same people who've always been able to vaccinate. Nurses, pharmacists, physicians have always traditionally been able to. There are some groups that we've opened up to allowing that have had training and are knowledgeable in handling medications and administering medications into the skin, and those include paramedics, pharmacy techs, and under certain circumstances, people who are trainees, such as nursing students and with the proper supervision, would also be able to deliver the vaccine.
Terrific. So I'm pretty reassured by all that. The big questions come up. When is New Jersey going to get more vaccine? Can you speculate on that or give us some information? What do you think?
Sure. So New Jersey has seen an increase in vaccine. We started out receiving about 100,000 doses a week for the first dose, the primary vaccine, and we've already seen that amount go up. So we have seen increases. It is not enough to meet the overwhelming demand, but it has been really increasing slowly but surely.
Well, that's great news. And it sounds as if we'll have enough places to give the vaccine as soon as we get more. So right now, Jennifer, where would a person, how can they register at enough places to be sure that they will get an appointment when an appointment opens up?
Yeah, that's absolutely one of our biggest concerns right now, is making sure that people can get to those locations to be vaccinated. So first off, the one-step method would be to register with the state's New Jersey vaccine scheduling system. This is a 2-part process where an individual would first pre-register online at covid19.nj.gov/vaccine. And then when an appointment is available to them based off of their eligibility group and based off of the availability of appointments, they'll be able to schedule at one of the vaccine sites that participates in that scheduling system. In addition, we know that many hospitals, pharmacies, et cetera, have their own scheduling systems. And so we have a master list at that same website that has all of the different locations throughout the state that are open to eligible populations. There are phone numbers and web links for each of those locations. In addition, if someone needs some extra tender loving care in navigating this system, there is a statewide call center that we've launched. The number is 855-568-0545. That's open 7 days a week, 12 hours a day from 8 to 8 to help individuals navigate the registration and scheduling process.
And how about for people who don't speak English? Does the call center have interpreters?
That's definitely something that's top of mind for us. We do know that the website that we've created can be translated with Google Translate into a number of languages. So in terms of the web access, there is that method for translation at this time.
And can you give us that phone number one more time?
My pleasure. 855-568-0545.
how does the state decide which cities get vaccines? Either Dr. Adinaro or Jennifer.
The first thing to keep in mind is that we have about 1,700 different facilities that would like to be vaccinated. And right now, we're only using a small percentage of that. So as vaccine grows, our supply grows, we will be activating more of those places to be doing the vaccine. Right now, we've been focused on ensuring that that the vaccine is distributed as much as possible throughout the state. We have a process every week where we look at specifically the amount that each county is receiving and monitor the doses per 100,000 that are given to residents in counties and look for any inequities in that area. And we also are particularly interested in making sure that we have sites that are in communities that do not have a lot of mobility. So particularly in our cities where transportation may not necessarily be by car. And so we're particularly interested in places like the pharmacies that Jennifer mentioned, working with local health departments in the counties, the sites they offer, and obviously pharmacies played a major role, and will continue to play a major role as we move forward.
Yeah, I'll just add to that we really have set a high bar for each of these locations, that they're really strong at getting people through the door as quickly and as effectively and safely as possible, as well as ensuring proper vaccine stewardship. We know that every dose is so precious and important, and so ensuring that there's proper handling and storage of these commodities, that they have scheduling systems that are robust, and that, as Dr. Adinaro said, that they're in communities that need the vaccine in their proximity.
That sounds great. Have we done anything to either outreach to the people who live in these communities or provide transportation for those who may not be able to access transportation?
Yes, this is somewhere where there's definitely more room to grow. We know that not everyone is going to be within walking or easy driving distance to a vaccine site. So certainly trying to get as many sites as possible on public transportation is something that's going to be important for us as we move forward. That said, we are starting a series of pop-ups in communities that may not have ready transportation access in order to help serve those populations as well. This is a growth process for all of us. And so as we're hearing these concerns, we're trying to address them. I will say through Medicaid, some individuals may qualify for Logisticare if they already participate in that service, and that service could potentially be used to get to a point of dispensing.
It's a great idea. A question has come up about immigrants. Should people who are undocumented be concerned? How do they access the vaccine?
They access the vaccine the same way as everyone else. That's the bottom line, is that we are a diverse state, and we want to ensure that everyone who calls New Jersey home is able to be served here. As Dr. Adinaro mentioned, our eligibility is quite broad. It's to everyone who lives, works, or studies in the state and meets one of those other criteria, and that certainly does include our undocumented neighbors. With that, any data that's collected in this process can only be used for public health purposes, and so we hope that gives some relief that no data will be used for any immigration detention, civil or criminal enforcement activities.
I think that's a really important point for people to know. This information is strictly for public health, and it's not being shared outside of the public health. It's really to find out, are you eligible to get the vaccine and to get that second dose scheduled if you need the second dose. Now, can you choose which vaccine you want when you go to these sites, Dr. Adinaro?
The different sites, depending on the type, will have a different vaccine, but we do not currently have any sites that have both types of vaccines simultaneously there. So if you have a preference for one or the other, you certainly can ask what they have, but given our limited supply, I think it would be very hard for somebody to seek out a specific type of vaccine over another one.
I'll also add that for individuals who are 16 or 17, they're only eligible to receive the Pfizer vaccine. And so we'd encourage anyone who is in that age cohort, if you're a minor or if you're a parent who's looking to get your minor child vaccinated, our master list at covid19.nj.gov/vaccine does list the minimum age requirement at each location. And so that'll give you a sense of which sites are Pfizer sites versus Moderna sites.
That's a great point. Thanks for reminding me of teenagers. I should have asked you about that before. One other question. If I'm not yet eligible, is there something I should be doing now to get my name on a list somewhere?
Certainly, you can pre-register at the sites that we've listed previously. You also could be a huge help in getting your family and friends and neighbors registered as well. We all have older relatives that would qualify, friends who might have comorbidities, et cetera. So certainly there's a large part of the vaccination effort that goes well beyond getting yourself vaccinated.
Terrific. Now, we know that both the Pfizer and the Moderna are two-dose series for that vaccine. Dr. Adinaro, is it really important that you get that second dose?
It is. It's important to understand that, those recommendations are based upon the studies that were done by the manufacturers to receive approval from the vaccine. And they measure the effectiveness of these vaccines based upon completing a two-dose regimen. So to have the full effect of the vaccine and really for all the benefits that we know the vaccines provide, it is really important to get that second dose as recommended.
And you should be getting that appointment for the second dose right at the time you get your first dose. Is that correct?
Correct. We strongly encourage all of our vaccinators to provide a scheduled second dose appointment at the time that they are receiving their first dose, and that there also should be a reminder process to help remind the person of when that appointment is coming up.
Now, once you get vaccinated, how about it? Should you change your lifestyle? Can you now go to restaurants, movie theaters? What's the deal here?
So you can still continue to do all the things you did previously, but with all the same precautions that you had before. So there is you've had a vaccine, you can start licking lampposts or things along those lines. You're still going to need a social distance. You're still going to need to wear a mask. You're still going to, be cautious in terms of your interactions. We're hoping, obviously, that as more people get vaccinated, that our need for these type of restrictions will lessen. But for the individual right now, having gotten the vaccine, while it does protect you, we don't know if it's necessarily protecting everybody else, and we still need you to observe the same precautions.
Thank you very much. And David and Jennifer, thank you both for joining in this podcast. This has really been very useful. For our audience, thank you for listening. If you want to learn more about COVID-19 vaccine in New Jersey, you should visit covid19.nj.gov/vaccine. Now, remember, everyone, whether you've had the vaccine or not, we still need you to take those precautions. Please wear a mask, and even inside if you're inside with other people. Avoid large groups and avoid small groups. Wash your hands lots. Make sure that the surfaces around you are cleaned. And please, if you're sick, stay home, get tested. Don't expose your friends, your neighbors, your loved ones, or anyone else. So thank you for watching, and stay safe, New Jersey.